Hello, I'm Tamara Pope, Vice President, Marketing and Communications at Hamilton Health Sciences Foundation. As our Innovations in Vital Care series continues, we hope that you are enjoying hearing from some of the experts at Hamilton Health Sciences. For this week's episode, our focus turns to the care and treatment of children and youth with cancer. McMaster Children's Hospital is home to the only inpatient pediatric cancer program in South Central Ontario. Dr. Adam Fleming is a pediatric neuro-oncologist, and today he'll be speaking about the specialized healthcare services available for pediatric hematology and oncology patients at McMaster Children's Hospital. For today's episode of Innovations in Vital Care, it's my pleasure to introduce Dr. Adam Fleming.
Well, thank you for the opportunity to chat with you today. My name is Adam Fleming, and I'm one of the pediatric hematologists, oncologists at McMaster Children's Hospital as part of Hamilton Health Sciences. And I have the privilege of looking after the pediatric neuro-oncology patients here, and that's the patients with brain or spinal tumors. And kind of an amazing opportunity for me as someone who started at McMaster many years ago. Started on my path in chemical engineering. I went on to biomedical engineering at U of T and eventually to medical school, out to UBC and to Boston to finish some training in oncology. Worked at McGill as my first real kind of neuro-oncology leadership role, and then come full circle to McMaster. So happy to be back here almost 20 years after I left. But what I get to do is really look at the population here, and with stock footage kind of representing what children are able to do, which is accommodate for things that are going wrong with them, and really kind of, they don't complain necessarily, but sometimes we rely on the imaging to show us that suddenly there's a tumor somewhere in the brain, and a brain is, as much as we know these days, still a great mystery to us. So for me, it's really pairing symptoms that kids come in with. What do they actually have? And when we're working with brain tumors, we know that it starts with one cell that has a tiny error, prevents that cell from acting normal, and that cell continues to divide and may or may not spread to other parts of the brain. But that these are really things that happen to everybody. And in the pediatric world, we deal with in utero up to 18 years old. People all over the world get brain tumors. It's not a modern phenomena. It's just that the modern MRI machine has only been around for a few decades. And so it sometimes feels more of a modern phenomena. But really in pediatrics, very few known causes. Patients will present at any age, sometimes being picked up through this most simplest, straightforward, easy means like good primary care, noticing that a child's head circumference is increasing, and then that could reflect a condition we call hydrocephalus, which is swelling in the brain from an obstruction along the way. So we end up seeing these patients here, and my clinical job at MAC is to give my expertise on both prognosis and the treatment options that are laid out in front of us. And when we talk about a plan, it's not just my plan, it's the bigger picture, but the theme of it is always to give as much treatment as we have to, and really as little as we can get away with, knowing that most of our patients are young and will live with the consequences of treatment for years to come. So we really prescribe and manage the side effects of chemotherapy, but we engage families in exciting research, talk about the prognosis and where we think this is going to be going, recognizing potential treatment failures, which are a reality in brain tumor work, and realistic engagement with new treatments or clinical trials for our patients, McMaster, or anywhere that we have the most appropriate opportunity for them. Because everything in our world really comes down to three major pillars of what we can do for children with brain tumors. It's really brain surgery, radiation, and or medications. Not everybody will need all three of these, but that's the backbone of what we use as our tools. But that toolbox is delivered by an enormous team of people who are, this is probably just the beginning of the list of people in a multidisciplinary team and a tremendous effort from so many areas of the hospital and the health system in Hamilton, not to mention the community that reaches out to support these kids in the school and home environments as well. So it really, one of the things I enjoy is we come into this very multidisciplinary effort to address the different things that happen to kids related to their brain tumors and related to the treatments they require. We have a fun clinic where kids, well, I think it's fun sometimes. The kids get to play around in a, send their dollies through a pretend CT MRI scanner, engage in some of the entertainment while they're getting their treatment, and of course get checkups from us. The surgeons who have to do the work in the OR are the ones dealing with the actual tumor, and then under the microscope doing the surgery, handing it over to the pathologists who are telling us exactly what we're treating. And the radiologists are the ones who kind of send us in there in the first place. My job is more the chemotherapy side. So what treatments are going to really take us into a cure or allow the radiation or surgery to work even better? There's so many new opportunities for us. The radiation, which is delivered at the Juravinski Cancer Center, allows children to have treatment with all kinds of child life facilities. This is a stock image, but showing what children have to go through lying with their teddy bear on their chest and the daily treatment of radiation. And really our goal is to take the tumor out to allow the child to heal and get back to a normal life as soon as they can. And it's absolutely remarkable what some children are able to achieve after they've gone through a ton of treatment with their, we say neuroplasticity, but it's really just their incredible resilience in the big scheme of things. So we know that we've got lots of challenges. Some tumors are unresectable with modern tools anyway. Some children are too vulnerable to get radiation. If they're very young, we try not to use it. And yet some brain tumors are simply resistant to chemotherapy. And we have chemotherapy that may not even get into the brain. So we know that amongst the children that are cured, there is still a great cost to that. We work very hard on a combined adult and child long-term follow-up clinic to really address as many of these issues for life in our patients: educational, cognitive, neurodeficits, vision and hearing, the physical impact on growth and development, the psychological impact. There's just so many different ways that the tumor, the treatment, and the entire journey for the family can impact their lifelong experience, and we're there every step of the way with our combined clinic. We hope to achieve more and more of what we call targeted therapy, and that's getting away from chemotherapy that affects every cell in the body and really start to get into newer medications that will take advantage of something unique in those tumor cells. Maybe these will be oral medications in some cases, and they may have different side effects, but leading the way 10 years ago, articles like this one from the Lancet were starting to show us that with a medication alone, a tumor that you absolutely needed to do surgery on 20 years ago could suddenly be treated and would start to shrink away, sometimes to the point where the patient has a clear MRI. And this can be achieved with a medication that in this particular paper is looking at tuberous sclerosis patients, can be replacing surgery entirely and with very, very few side effects. So our goal is to take the patients who have big tumors and really allow them to move on with their lives and to live as fulfilling a life as they can.
Oh, that's wonderful. Well, thanks so much. And what I think a lot of people are surprised at is, I think when a lot of people hear the words brain tumor, they think of an adult, or they might think of a teenager, but really you can get a brain tumor at any age, including, if I understand, even if you're a newborn.
Yeah, no, it's heartbreaking. I think in the world at large, I think brain tumor exists as a word unto itself. For us who deal with this, the word brain tumor represents probably 300 different diseases. So it really comes down to what's the specific we say histology of that tumor, but what's the real name for that tumor, and how is that going to help us know how to treat it? Babies can be born with brain tumors. It's incredibly rare, but then we have a whole other set of circumstances. Really, I think the emphasis in all of pediatric oncology work that we do, there's very few things that could ever be caused by the outside environment, but we're dealing with cells in the child's body that are reproducing, growing, and doing so many new things every day that one tiny error could happen that is either inconsequential or of great consequence. And so, brain tumors probably in a lifetime risk for all humans everywhere, 1 in 150. In children, the incidence is more like 5 or 6 out of 100,000 children. So very, very rare. At McMaster, we might see 25 or 30 new patients a year coming in with brain tumors. And so you can appreciate how difficult it is on families who, like you said, Aaron, probably didn't know that this was even possible at their kid's age.
And are there any specific challenges to treating really young patients just by virtue of the fact that their brains are still so small and are still developing?
Mm-hmm. Mm-hmm. Well, there's certainly good things and really tricky things about that. And the good side, children heal very quickly. And when we're very young, before the age of 1 or 2 especially, our skull bones are very soft, they're growing and they're flexible, and so some kids can come in with less severe symptoms because they have some degree of accommodation for the growth of that tumor. And children, when they need treatment, the rest of their body is in really good health for the most part. And so if you're thinking about chemotherapy or radiation, generally their kidneys, their heart, their lungs are all in perfectly good health. And so they can tolerate a lot of treatment. And in fact, ironically, a lot more treatment, stronger chemotherapy treatment than we can tolerate as adults generally. The tough side is the radiation is really a very effective, powerful tool against tumor cells, but it also can damage the tissues as it travels into the brain. And that's something we have to recognize has some degree of permanent effect on children as they grow. And so we have to be aware that if there's a way to defer the radiation, put it off to later, or eliminate it entirely, we'll take that in younger children every time. If it's the only way to give curative treatment, we will use it in what we have access to, which is one of the best facilities in Canada at the Juravinsky Hospital with a fantastic team there. Third part of it, the surgical part of it, well, we've got 3 exceptionally talented pediatric neurosurgeons who really are trained specifically in dealing with children's brains, and their training involves again neurosurgical problems across the age spectrum. So a 250-pound 18-year-old 17-year-old to a half a pound newborn all has to be in their expertise, and we're lucky to have them competent in all of those ways.
Well, I know my colleagues and I here at Hamilton Health Sciences Foundation were very proud to help enable the purchase of a neurosurgical microscope that could be used for pediatric patients. So it is interesting to see how technology is allowing greater imaging and more precision in terms of working with pediatric patients.
Mm-hmm.
And hopefully the technology continues to improve like that.
Absolutely.
Yeah. Now, for you personally, what is the most fulfilling part of the work you do?
Oh boy, that's a great question. I mean, so many parts of my job have that fulfillment there, being able to help a family go from what I said before, which is coming in the door in their scariest time, maybe never have having heard of a pediatric brain tumor, and being able to walk with them in the journey, really focusing on the language that I use, the wording, letting things out in a, kind of educating and providing care at the same time, helping the family just slowly get to know pieces of the puzzle that are going to allow them to care for their child, understand the disease that they're facing, and help us make the best decisions together with them. That's very fulfilling. I think, like I said before, children are very resilient. We know across the spectrum in pediatrics, they will, play and get an active as soon as they're able to. And so it's always fulfilling to see that kid come out of surgery and, go through a couple of rough days of healing. And the next thing you know, they're in the playroom. And certainly for kids who are getting through their treatment, going on to survivorship and moving into our aftercare clinics and programs, seeing some of the mentorship that they're able to provide and that their families are able to provide for new parents coming in who are terrified just like they were at the beginning. And whether that's seeing them in the clinic or through some of the groups and support groups that exist out there, but allowing them to kind of teach the families in a way that only they know the experience that they've had.
And here at the foundation, certainly we're fundraising and engaging donors because we want to do everything we can to make sure that you and your colleagues have the equipment and the tools needed to deliver the best care possible. If you could deliver a message to a donor about the importance of supporting the foundation, what would you tell them?
Well, I think first I'd tell them thank you very much. I think I would emphasize that sometimes in healthcare, especially maybe in Canada, we think healthcare is covered and healthcare is free. And yes, medical care, surgical care, basic provision and hospital care is provided. And I think it's world-class. I don't think that there's, having worked on both sides of the border, I don't think there's a better healthcare system. But families facing something like a brain tumor and many other things in this building, a children's hospital, there's so much more to it. Things that aren't really covered in healthcare, things that can make just a phenomenal difference in somebody's life. You can take a family's donation to a coffee pod machine in the parents' lounge, and that can just be the place where they can go and have a bit of sanity and safety and a cup of coffee that means the world to them on the toughest day. They can have artwork, or they can have somebody volunteering to provide something colorful. They can provide an experience that is far beyond the essential medical care. So if donors aren't providing the basic medicine, the necessity, but that's only the beginning. And the experience for children to come out of their room and to be able to look around them and feel well cared for by every part of this hospital is such a tremendous difference. We can't begin to even express that. So much more than the excellent, good quality medicine and nursing care and everything else that goes on here. There are things that are really ancillary, but they go above and beyond. In a disease that goes above and beyond, it's nice to be able to match that.
Well, beyond the equipment we talked about, I think you touched on it earlier. The environment itself is very, very welcoming. It's nurturing. And I've had the privilege of speaking with families and patients who realize, certainly given a choice, they wouldn't want to have to go through cancer treatment. But because they do, they feel very comfortable visiting the hospital, and they really look forward to meeting their friends in clinic in terms of other patients, but also the physicians and the nurses and the therapists. And it really feels like a second home away from home for a lot of these patients. And I think that that's wonderful. And I'm so glad that you shared some of those photographs, because I think that clinic is it really is a magical place.
Yeah. There's really, we recognize, even though we do this every day, we come to work and we commit our lives to this, the only people that really understand what families are going through many times are their peers in that environment, the other families that have been there with them and before them. And there's so much support that can come out of that. A comforting environment. You'll notice a kid striking up a conversation with another kid their age, And if you have the privilege of listening in, the wisdom they're sharing, even if they're 5 or 6 years old sometimes, is quite remarkable. So it's really nice to have a physical space where we can provide that care and realize we're not just bringing kids in for a quick checkup and they leave. They sometimes sit in our clinic for hours, blood transfusions, chemotherapy, long conversations, multiple team members needing to work with them, physiotherapists doing some rehabilitation at their weekly visit. So it's really something that it is a comprehensive care, and our clinic is both an outpatient facility and essentially a 5-day-a-week, very busy day hospital. So to give them a bit of a comfort zone, I know a lot of kids are feeling the impact of COVID-19 on the number of toys they have access to, and it's been tricky to navigate that. It's less crowded in there than I showed you in some of those pictures these days.
Well, thank you so much for taking the time to talk with us. I think there's a lot of interesting information, and it gives some really interesting insights into the important work you do. So I really appreciate that. So thanks so much.
Aaron, always my pleasure. Happy to chat, and thank you to everyone who supports us here at the Children's Hospital.